So, yeah, when I was 15, I just started going to the bathroom 8, 9, 10 times a day, not digesting any food because my GI tract is like literally just attacking itself. It's very weird. Your immune system in your gut thinks your gut is a foreign invader. And so it just starts attacking itself, which if you're just using the bathroom 10 times a day, not digesting food, that's why you drop weight rapidly. And it hurts like crazy because it gets very inflamed and it feels like someone's stabbing you in the gut with like a knife constantly when it's really, really bad, which is what I had. So I lost 50 pounds, which is crazy because I was already relatively lanky.
Did you know that the world's most famous YouTuber, MrBeast, who can spend millions of dollars on a single video, has been fighting a monster disease since he was 15? But this is not a common stomachache. This is Crohn's disease, a civil war in which your own immune system turns to attack and excavate your intestinal lining, potentially leading to blockages, fistulas, and even the surgical removal of a part of your body. So is Crohn's disease dangerous, and what are its symptoms? How is it treated? Does it have many complications? And what will MrBeast's prognosis be? I'm Dr. Minions, a master of medicine specializing in emergency and critical care, and today we are going to explore this disease. Many of us surely know Jimmy Donaldson, or MrBeast, a young man full of energy who creates incredible charity videos and challenges. But behind that smile and generosity is a silent battle that Jimmy has faced since he was a teenager. At 15, he was diagnosed with Crohn's disease. For nearly a decade, Jimmy has managed his condition, but now, as he enters his late 20s, he is entering a phase where many Crohn's patients first experience flare-ups severe enough to disrupt daily life. This is a critical time, a turning point that will determine his quality of life for years to come. MrBeast's story is a powerful reminder. This disease spares no one, no matter how rich or famous you are, but it is also a story of hope. Understanding your enemy, how it progresses, how it's treated, and its long-term outlook is the surest way to turn anxiety into powerful action. So today, let's begin this journey together. Crohn's disease is a type of inflammatory bowel disease, IBD. This condition causes inflammation of the lining of the colon and digestive tract, making digestion very difficult for the patient. Imagine your intestinal tract is a peaceful nation. Suddenly one day, the nation's defense force, the immune system, experiences a system error. Instead of attacking foreign invaders like harmful bacteria or viruses, it turns on its own citizens, the mucosal lining inside the intestines. This is not a short war. It is a chronic inflammatory condition, meaning it is persistent, lasting nearly a lifetime. This attack creates deep, non-continuous ulcers, like scattered bomb craters. These ulcers can dig deep, penetrating through the entire intestinal wall, leading to extremely dangerous complications that we will discuss later. And this war can occur anywhere in the territory of the digestive tract, from the mouth to the anus, but it is most common in the final part of the small intestine and the beginning of the colon. This disease is not as rare as you might think. About 6 to 8 million people worldwide live with it, and up to 70% of patients, like MrBeast, are diagnosed before the age of 30. Crohn's disease typically follows a relapsing, remitting course. This means there will be peaceful periods where you feel completely normal, lasting several months or even years, but then there will be flare-ups with a return of symptoms. Is Crohn's disease dangerous? Basically, Crohn's has the potential to become dangerous, but this rate is low. Mostly, Crohn's causes chronic and intermittent symptoms. According to studies on over 1,000 people with this disease, 20% of mild cases have symptoms that gradually remit. Dangerous complications include intestinal stricture, fistulas, abscesses, and multi-organ inflammation, with an occurrence rate of about 50% after 20 years from disease onset. For MrBeast, who was diagnosed at 15, the most tiring and severe phase for him will be around age 35. This disease is not immediately life-threatening, but it causes discomfort, poor nutrient absorption, constant digestive disorders, and abdominal pain, leading to a reduced quality of life for MrBeast. How is Crohn's disease detected? The diagnosis of Crohn's is primarily based on clinical symptoms, blood tests, and endoscopic imaging of the colon and intestines. The symptoms of Crohn's disease include abdominal pain and chronic diarrhea are the most common symptoms because the patient's intestines are constantly inflamed, leading to poor food absorption. Other symptoms include fatigue, weight loss, and fever. In severe cases, additional symptoms may occur due to transmural inflammation through the wall, inflammation of surrounding organs like the bladder, cystitis, peritonitis, intestinal fistulas, abscesses, etc. But these symptoms are seen in many digestive diseases. Therefore, diagnosis requires differentiation between many conditions and combining with blood tests and endoscopic imaging. Blood tests for a Crohn's patient may show a reduction in red blood cells, electrolyte imbalances, issues with liver and kidney function, increased CRP, indicating inflammation, and deficiencies in iron, vitamin D, and vitamin B12. Endoscopy. The endoscopic results may show characteristic images like this. The lesions include localized ulcers adjacent to areas of normal mucosa, along with changes in the intestinal mucosal shape that look like polyp-like hypertrophic masses. If not well controlled, prolonged inflammation will cause scarring, altering the structure of the intestines and leading to dangerous complications. Stricture. Imagine your intestine is a pipe. Scarring from inflammation narrows the pipe, causing a blockage. Food cannot pass, leading to vomiting and severe pain. Fistula. The ulcers can dig deep, puncturing the intestinal wall and creating an abnormal tunnel connecting the intestine to other organs, like the bladder, causing urinary tract infections, the skin, creating a draining fistula or other loops of intestines. Abscess. When a fistula gets blocked, pus can accumulate, forming a large infected pocket in the abdomen, causing high fever and severe pain, which can be life-threatening. Increased risk of colorectal cancer. After many years of active inflammation in the colon, the risk of cancer increases. So how is Crohn's disease treated? Our goals are to suppress the flare-up, to maintain long-term peace, to prevent complications. Most cases of Crohn's are chronic and 20% are mild. Therefore, symptomatic treatment is primary. Doctors will prescribe antibiotics, pain relievers, anti-inflammatories, medication for indigestion, and immunosuppressants if it's severe. When the disease worsens and complications like peritonitis, intestinal fistulas, abscesses, bowel obstruction, or even progression to cancer occur, surgery becomes a mandatory measure. In MrBeast's case, he has a lot of money, and I am sure the doctors treating him are the best. We wish the best for MrBeast. And if you are experiencing health problems or no longer have morning erections, click on this video.